Good afternoon. Thank you for joining us for our noon press conference from the city of Tulsa. We'll be started off by Dr. Dart with the Tulsa Health Department.
Thank you, Richard, and good afternoon, everyone. As of today, there have been a total of 390 Tulsa County residents infected with COVID-19, and tragically, 22 of those patients have died. There have been some positive signs on our modeling data, but we must remain vigilant in our social distancing efforts and continue on this path. We have seen some slight flattening, and if we continue to maintain distancing, we'll see even greater flattening. We have currently at Tulsa Health Department around 700 specimen collection kits available. We will continue with our pod operations today and pick them up again next week. We are testing those with exposure to a confirmed patient or showing symptoms of COVID-19. We are still listed as an undisclosed location for the safety of our community and our staff. Appointments are required for testing, and please, if you are concerned about your status, call the Tulsa Health Department 918-582-9355 to schedule an appointment. We have built a system around resources of PPE and testing kits and collection kits, and as these resources continue to become more available, we will continue to expand our testing. We do require an appointment, so it can remain a contactless experience for infection control purposes. We are working with our National Guard, who is assisting us as a courier to deliver specimens collection to the lab for testing. We have received a donation of gloves and trash bags. We will do inventory and look at getting these out to our partners as needed. And this week, we also received a support nurse from OSTH to join our task force for long-term care facilities and other high-risk settings. This task force will be a point of contact for these centers to ensure proper protocols and identification and containment of COVID-19 in the event of an outbreak. Again, as we've been previously saying, please do not go to the emergency room unless you have a true medical emergency. If you have to call 911, tell your operator about your symptoms so that responders can take the appropriate precautions. If your symptoms are manageable at home, please stay home until you are 7 days away from the onset of symptoms and have improved and are 72 hours fever-free without fever-reducing medications. If you are sick with other symptoms or symptoms become unmanageable at home, please call your healthcare provider to discuss a treatment plan. Don't wait too long to call your doctor's office or to go to the ER if you need to. We want you to seek medical attention if you need it and when you need it. We assure you that healthcare systems across Tulsa County are taking extra precautionary measures to make sure patients can safely visit doctor's offices, emergency rooms, and urgent care centers. The Tulsa Health Department has partnered with the Oklahoma State Department of Health, the Oklahoma Department of Mental Health and Substance Abuse Services, and MyCare to offer citizens receiving services at THD who may find themselves in crisis. Starting next week, clients coming into THD for scheduled services who may be identified by our staff as experiencing domestic abuse, addiction, or stress can use iPads in a private room to televisit with a counselor for free. For a free public mental health resource, the Disaster Distress Helpline is available by calling 1-800-985-5990. We are still projecting a peak of new infections to happen within the next week. So this time is crucial for staying home as much as possible and limiting social contact. We are aware of the talks about opening the economy back up. I've looked at what the president has put out and are having conversations with local leaders at this time about how to do this consistently throughout Tulsa County from community to community. I think it's important when we look at reopening small businesses, we let the data drive that conversation rather than a specific date. Regardless, the important criteria is if testing has expanded enough to gauge in a true count the virus penetration in Tulsa. We want to know that hospitals have enough PPE because when people come together, there's a possibility of another surge or another peak. When we begin gathering again, we will see that surge, and we want to make sure hospitals can address this issue without being overwhelmed. We will continue aggressive contact tracing measures here at the health department, but again, as numbers increase, we will look at how we're going to continue to manage that. I had no doubt that Tulsa and our state will survive this crisis. I would rather look back at our actions today as being overcautious and being criticized for that than relaxing these restricted measures too soon. The last thing we need to see is more people getting sick in Tulsa County, and more importantly, we don't want to see any more deaths in Tulsa County. I do know everyone is anxious about opening back up, but let's resist that temptation. We're doing things the right way here. If we continue restrictions, this will last less than if we open things up too soon. We truly appreciate everyone's patience. We are pulling through this, and we are going to get through this. So that being said, I would like to introduce at this time Mayor Bynum.
Thank you, Dr. Dart. Please stand by. Mayor G.T. Bynum, City of Tulsa.
Thank you, Dr. Dart. I can never say it enough times how grateful I am for you and your team and the guidance that you provide us here in Tulsa as we try to keep people safe. There are several important things I want to talk about in today's briefing. The first is the one that we're certainly hearing a lot about right now, which is how we re-engage so much of our economy here in Tulsa. I think it's important to distinguish two different tracks that we're working on. You know, the great Tulsa businessman who did so much for our city, Wade Phillips, had a great saying that I always think about, which is the when is as important as the how. And those are the two things that we're really focused on right now. The when is one that I really rely heavily on the Tulsa Health Department to let us know when is a safe time to re-engage parts of our economy that have been necessarily closed down due to the coronavirus pandemic that's afflicting the entire globe. And in the conversations I've had with Dr. Dart, what we recognize is that what we have to do is look at overall positive test cases in Tulsa. Now that testing is widely deployed, as you've heard Dr. Dart mention before, we now have at the Tulsa Health Department the ability to test people. If you have one symptom, you can call the Tulsa Health Department or your healthcare provider to get a test taken. The state of Oklahoma has over 80 different testing sites set up around the state for people to get the tests that they need. And now that we've established much better levels of testing than we had at the outset of this, we're able to get a better feel for the daily rate at which we're being afflicted with this virus and the rate at which people are contracting it. And so all the modeling that we've had to date shows that this week is anticipated, as I've said many times, to be the peak of the contagion rate. But we won't truly know that. That's based on modeling. We won't truly know that until people who have contracted it this week, and it's usually about 3 to 5 days before people start to notice symptoms of having COVID-19, and then they can get a test. We would expect to see those tests. If this week truly has been the peak of contagion rate, we would expect to see those tests also peaking sometime next week. The key for us is that you want to see a decline over a period of time. In some cases, it's 7 days. In other cases, it's 14. But you want to see, at the very least, 7 days of declining daily positive tests in a community. And so the Tulsa Health Department, as they report that data to us on a daily basis, that's the number that I'm keeping an eye on. And in conversations with Dr. Dart and looking at the data that's out there from Centers for Disease Control and others, what you really want to identify is, one, do you have that steady decline in positive tests? And then two, does your hospital system have the capacity to handle the number of hospitalizations that you're seeing? And if you have both of those cases, that kind of answers a lot of your when question as to when we could start to roll back some of the social distancing practices that we've had to put in place in our community over the last month. Now, the other big aspect of this, though, is the how. And I don't want anyone to have the assumption that we go and flip a switch and everything is the way it was in February. I've not heard any public health professional suggest that that's what ought to be done. I haven't heard the governor suggest that. I haven't heard the president suggest that, contrary to what seems to be interpreted by a lot of their statements. But what I do hear a lot of people talking about, and what we will do here in Tulsa, is a phased approach. And that is a way of cautiously proceeding with reopening aspects of our economy that have been shuttered, but not necessarily reopening them the same way that they were in February. There are modifications that need to be made to make them safer for people. And I'm very grateful for people like Elliot Nelson, who's helping me identify ways that we can do that with restaurants in Tulsa, people like Marilyn Iloff, who's helping me identify ways that we can do that with salons. Anna America, our parks director, is helping with a lot of park aspects and public recreation aspects. And so we're talking with business leaders and community leaders here in Tulsa about what those modifications look like when the health department has given us the go-ahead to start rolling things back. Any of those modifications, I'm also going to want the health department to review and make sure that they tell us that these are the things that can keep people safe. And I think it's very important for people to understand that this is as much about public confidence as anything else. The governor could lift every order tomorrow. I could do the same. But if Tulsans don't feel safe to go to businesses around our community because they think that things were just opened up willy-nilly without any acknowledgement that there's still a virus that most people in our community aren't immune to, then they're not going to go and shop. They're not going to utilize restaurants and retail facilities unless they know that the proper steps have been put in place to make those places safe for all of us to use. And so building up and having in place those things that allow for that consumer confidence is so important as we go about re-engaging our economy. And so I'm having those discussions with business leaders and community leaders here in Tulsa as we develop that plan. Right now, our orders run through April 30th. There will not be any lifting between now and that date. But I also haven't determined what needs to be extended past that date. We're going to evaluate this in partnership with the Tulsa Health Department day by day, and we're going to proceed with caution. I want everyone in Tulsa to know that when we do roll things back, we're doing them not because people were angry or in a rush to get things done. We're doing them because public health officials believe that they are safe to do. And that's the only time that we're going to move forward on that front. So that's the first one. I just wanted everyone to understand, what our overall planning is based around. And my expectation would be that as we have those individual plans for things to do, and as we're tracking and getting nearer to a time when we believe that we can re-engage those aspects of our economy, you'll certainly hear about those at these briefings. The second update I have for people today is around the city of Tulsa itself and the city government. There are two great indicators that show what we can expect from a sales tax generation standpoint. And that's regional employment. As regional employment goes, usually our sales tax generation goes as well. And also crude oil prices, because that has such an impact on employment in Tulsa as well. And so as those rise, usually our economy does better and our sales tax generation does better. And as many of you know, we're the only state in the country that forces cities to be heavily reliant on sales tax. It's the only tax that we're able to utilize for operations. Cities in Oklahoma can't use property tax. So that makes us overly reliant on sales tax. And so what we see right now is an unprecedented spike in unemployment rates nationally, and we see crude oil prices in the tank at the moment. And those two phenomena have us very concerned about revenue generation for the city government in Tulsa. And so we're modeling our budgeting moving forward, looking at what we had to do going through the Great Recession in Tulsa. Just like we did last year with the flood, when in the early going, we kept trying to catch up with whatever water release rate people had, whatever the Corps of Engineers was announcing, and we'd create a map one day and then it would be useless the next because they changed the water flow rate. We finally decided we're going to prepare for the worst case scenario, and that was the 86 flood. And we gave everybody maps and everybody prepared for that, and we did just fine. Well, in this case, for us, the worst case recent scenario is the Great Recession of about 10 years ago. And so that's what we're planning for at the city of Tulsa. In order to that, and we're fortunate because we have tools at our disposal that we didn't have a decade ago, like a rainy day fund that the city council and I have been very aggressive in putting money into over the last couple of years. At the outset of this pandemic, we initiated a hiring freeze. At the outset of this pandemic, we also initiated a travel freeze. But in looking at what our projections are for the year ahead, we recognize that even with all of those things, they're not going to be enough to maintain our service levels to protect the citizens of Tulsa the way that Tulsans should be protected. And so we've made a very difficult decision, but a necessary one, I believe, that we will initiate half-day furlough days every single week, beginning on May 3rd. And those will run through December 26th. That is for non-sworn employees at the city of Tulsa whose pay is funded by our general fund that is driven by sales and use tax. Police officers and firefighters and 911 operators are not impacted by this. This will not impact public safety service levels in Tulsa. This also will not impact those employees who are funded through utility rate payments. But for those of us who work for the city of Tulsa, who are reliant on sales tax for our pay, we will be taking the equivalent of a 10% pay cut over the next several months going into December. I say we, I include myself in that. I wouldn't ask any city of Tulsa employee to make a sacrifice I wasn't willing to make myself. And so I'll be taking that pay cut, as will every member of my staff in the mayor's office. We are doing this to protect the jobs of our team at the city of Tulsa. And this kind of reduction in pay, I believe, is necessary going into a fiscal year with great economic uncertainty, both locally and nationally. And so we're going to make these difficult decisions at the outset of the year, not try to catch up midway through the year. So those will go into effect on May 4th and again run through the end of the year. Another update on our small business relief efforts that we have here in Tulsa. I'm very pleased to report that we've had 207 applications for the Resilience and Recovery Fund for small businesses that the city of Tulsa is funding. So far, 15 loans have been approved for that to local small businesses that employ 193 Tulsans. There are additional loans that are being evaluated by the Tulsa Economic Development Corporation right now. So far, the main things that we've run into for those that we weren't able to process loans for were either a missing application information or a lack of just follow-up contact. But I think the thing I'm really excited about, though, that is an important measure that's helping a lot of people. The thing I'm most excited about, though, is that since April 1st, Tulsa Responds, the organization that we set up to help local businesses navigate not just local funding opportunities, but federal ones as well. That organization, Tulsa Responds, has helped local small businesses and entrepreneurs complete over 900 applications for federal aid since the 1st of April. That's tremendous work by the team at Tulsa Responds, and I'm very grateful for them. We had a question earlier at our briefing earlier in the week about the CARES Act. At the city of Tulsa, we're continuing to work with our colleagues in the neighboring counties and with Tulsa County in our federal delegation to evaluate what our opportunities are there. We're expecting further guidance from the Treasury Department to come soon. And so as we have more updates on that front, I will certainly let you know. Lastly, I just want to say that as we're concluding what we believe to be the crucial week for the prevention of the spread of this virus in Tulsa, how grateful I am for everyone who's taken it seriously. When you look at the death rates in Tulsa as they compare with other cities around the world that have been impacted by this, they are so much lower. And that is not because we're so much tougher here in Tulsa or that our immune systems are amazing or that we're so much healthier than everyone else in the world. They are lower because we as a community took action earlier in the event as it hit us locally than a lot of other communities around the world had a chance to. And so for everyone who acted quickly and early, I'm very grateful for that. I'm so thankful. You've saved thousands of lives in our city. And the important thing is that this virus is not going to evaporate into the air on May 1st. It's going to be around for a long time. And so how we can start to evolve the way that we go about our lives from where we are right now, which I think we all agree is not sustainable for the long term, where we are from right now to where we want to be so that we can get our economy re-engaged. That's the kind of work that I'm working with local businesses and with the Tulsa Health Department to help develop a plan that we can deploy when the health department tells us it's the right time to deploy it. With that, I'd like to turn it over to my colleague, County Commissioner Karen Keith.
Thank you, Mayor Bynum. Sorry, we have seemed to have some difficulties with Karen's connection, so we're going to move to Mental Health Association of Oklahoma, Mike Brose.
Yes, thank you so much. I want to just, on behalf of the citizens of Tulsa and the county, I'd like to just thank Mayor Bynum, Commissioner Keith, Dr. Dart with the City County Health Department for your leadership on this. As a citizen, your information, your leadership is invaluable to us as a community. And as the mayor just said, I think this community coming together in the way that we have and working together and acting quickly will help us as we move through this and do it as quickly and as prudently as possible. For our viewers, listeners, I think it's important. We've talked so much about universal health precautions, hand washing, social distancing, all the other safety, personal protection equipment, the use of masks. We've all done so much about that, and that is going to continue to be critically important. With that said, I appreciate the invitation to be on this press conference with the recognition that our mental health and our promotion of universal mental health precautions, that we need to make sure that all of ourselves, that we're caring for ourselves physically, but also mentally and emotionally as we work our way through this crisis. It is very stressful. There's we all have experience of anxiety. We're all having issues of some sleep disturbance and anxiety about our economic well-being. Those are understandable and to be fully expected. Universal mental health precautions. It's about right now about good nutrition, maintaining good nutrition, trying our very best to maintain our sleep and rest habits. So we're getting adequate rest, we're getting adequate sleep, and also that we're getting exercise. And again, many of us are used to exercising out into our parks, out in our communities and health clubs. That's been limited to some extent. Many of us are now having to transition into using exercise as a way to help us manage our anxiety and our stress and our worry at home. And so again, exercise, nutrition, rest, encourage people to do that. Now, beyond that, there are, prior to COVID-19, this crisis pandemic, many of our community have ongoing, regular, chronic mental health conditions that they have been involved in treatment. I want to reassure those families in that community that the community mental health center system continues to be open. It continues to be active, engaging. They're using safety precautions, telehealth, FaceTime, phone conversations to be able, and if you're isolated, please reach out to them. I want to remind everyone also, we're worried about people being isolated. If you know of anybody, a neighbor, a family member, a friend, someone you worship with who's alone, reach out to them, call them, text them, reach out to them on a regular basis while still practicing and utilizing social distancing. It's very important that we keep our neighbors and our friends and our loved ones in mind in their mental and physical well-being, that we do that. Again, I want to remind the viewers, 211 is available. Mental Health Association Oklahoma. Dr. Dart mentioned about the things that the health department is linked up with other state agencies, including the Oklahoma Department of Mental Health and Substance Abuse Services, to assist people. The mental health community is open and available, and you can go to our number, you can go to our website. The Mental Health Association is also offering virtual support groups, our regular support groups that we have for people who have depression, anxiety, bipolar disorder, for their family members. We've added other additional support groups, including those that are first responders, COVID-19 related first responders, people who are on the front lines, from our grocery checkers, people that are out there in the community continuing to have to be in essential positions. We have a support group just for them. It's virtual. We also have one just for the general public who are needing somewhere to connect with, to talk to hear what others are dealing with, and to learn and find out you're not alone. Those are all led by licensed mental health professionals. They're free. You can get the information on those from our website, mhaok.org. That's mhaok.org. Again, many people are concerned about our homeless population. The shelter system people are doing incredible, heroic work with that population. The outreach teams are out there using all safety precautions, but we're still outreaching to that community where people are still being housed. It's slower, but we are getting people housed as quickly as we can. I want to do a special shout out with the city of Tulsa, Becky Gligo, her leadership, and the team with Housing Solutions that are all working with all the different providers. I want to thank the Tulsa Area United Way for continuing to be very concerned about the financial well-being and strength, having all the resources that the nonprofit community needs. Again, during this time, I want to caution everyone to be careful about excessive use of substances, including alcohol, prescribed or non-prescribed medications. Be very, very careful with that. Also, we know that there's always a higher possibility of increased levels of child abuse, domestic violence. Again, reach out, get help. Let's protect each other. And above all, as families, I hear stories of families having dinner together they haven't done that for a long time. They're playing board games, they're having fun, they're finding ways to enjoy themselves in ways and finding those silver linings in the midst of this. So I want to thank our leadership and thank you for allowing me to come on to this press conference.
Okay, thank you, Mr. Brose. Stand by as we bring on our next speaker. Tulsa County Commissioner Karen Keith.
Hey, Mike Brose, thank you so much for all your work in these areas because it's absolutely critical at this time. And I know you're helping a lot of folks out. So I just want to give you a shout out and thank you. So on some good information for you to know that in order to help local governments cope with expenditures incurred during this COVID-19 pandemic, the federal government will begin distribution of funds starting next week. Each state will get an allocation based on their population. And then based on that calculation, Oklahoma is going to receive about $1.5 billion. Cities and counties in Oklahoma with a population over 500,000 are eligible to receive funding directly from the Department of Treasury. Now in Oklahoma, Tulsa and Oklahoma counties are the only two eligible counties, and Oklahoma City is the only eligible city. The rest of the counties and cities in Oklahoma will be eligible to share in the state's allocation, but Tulsa County will be looking at all expenses within the county. Now, these funds are to cover COVID-19 related expenses between March 1st and December 30th. So once the funds are received, they can only be used to pay for expenditures over current budget levels incurred due to public health emergency, and also for mitigating the impacts of COVID-19 in the immediate future. Yesterday, Commissioner Ron Peters completed the certification needed for participation by Tulsa County. So that's good news. Now, Tulsa County Court Services continues to staff the daily bond docket, including the weekends, to give judges the pertinent information they need about inmates booked into the county jail. The staff follows specific instructions for safety and social distancing so that when defendants are released on a court order, they can be sent home as quickly and safely as possible. Now, as Michael was talking about the homeless, the Archer corridor near the jail continues to be overcrowded with the homeless population. Some 55 men will be moved into the old juvenile building over McGilcrease beginning Monday. And during the day, others will be transported there for meals and access to telemedicine. In addition, a lease is being worked out for a 72-room hotel that will also begin to accommodate some of the most vulnerable citizens. And I would also like to thank Becky Gligo for heading up a lot of these efforts to help this population. Now, fortunately, we are not reporting any COVID cases in this population so far, and that also remains the case with the Tulsa County Jail. And kudos to the Tulsa Housing Authority. THA is waiving rent payments for April and May at its 17 properties in Tulsa. THA is hoping this will allow their tenants to move money into groceries and other necessities. And I want to close with a shout out to our suburban communities and thank them for their efforts to keep this pandemic in check. I know the mayor is reaching out to our area city managers in an effort to help us all work on a plan to reopen at a pace that does not make us vulnerable to increasing the spread and starting this process all over again. There is a great deal of cooperation between governing authorities. By working together, we can have far better outcomes in the long run. So stay the course. We can't just flip a switch, as the mayor said, so that we can all respond to the data and make informed decisions about what comes next. So please take care, everyone. And as Mike Brose was saying, let's enjoy this time that we have with our families, and we'll see you all out and about on the other side of this. Thank you so much.
Thank you, Commissioner Keith. Please stand by as we bring our other speakers back online. Okay, with everybody back, we'll now take questions from the press.
Our first question is for Dr. Dart from Channel 6. Can you describe the contact tracing process and a rough estimate of how many of Tulsa confirmed cases show indications they've transmitted to others?
So when we get the report, and by law, COVID-19 is reported to the state then turns around and sends that report to Tulsa Health Department. We reach out and contact every individual who has tested positive. And we find out that on average, each individual has as many as 35, 36, or 7 contacts. So, and in this, we don't just talk to patients once, because it takes a while for people to remember where they were in this 2-week period. So it's anywhere from 3 to 4 conversations with each individual patient. And so while we identify people who might have been possibly exposed to a COVID-19 patient, to say definitively how many people have had disease from that, we know that we've got 390 cases. We know that the vast majority of those are community acquired and not any other reason for them to be exposed. So anybody now who has COVID-19 is a possible source for transmission, which is why we're really vigilant about getting to that individual quickly and ensuring that they continue to quarantine, and then tracking those individuals they've been around, so that there's no spread from those potential patients as well.
Okay, from Fox 23 for Dr. Dart. Some people who are insured and or able to pay a small fee are willing to do so in order to get access to your tests. Would THD open up testing to these folks willing to pay for a test?
You know, not this juncture, because the healthcare systems are actually testing patients who are insured and who are members of their networks. And so if they really need a test and they have a healthcare provider and they're insured, they can get one through their healthcare system. And bottom line, though, you know, we're not anywhere near ready to test people who aren't sick. And we have limited supplies. We want to make sure that we're testing those people who need it most, people who have been exposed to a known COVID-19 patient, people who are experiencing symptoms. Eventually, we do hope to open up and do a broader testing and test anybody that wants to have a test. We're not there yet in terms of testing supplies. We'll be there eventually, but right now, if you are insured and you have a healthcare provider, you can get a test. So at least you can call them and be screened to find out if you need a test.
Okay, Fox 23 for Dr. Dart. How does your new testing plan fit into what the governor just announced about the testing at the OSU Health Science Center?
Are we talking about the antibody test that the governor talked about, or the fact that OU and OSU we're going to stand up testing pods? I think if we're talking about the stand up of testing pods, let's face it, that helps expand our testing. The more people tested, the more we'll have an idea of what the penetration of viruses into our community. I know that OSU has been working on developing an antibody test, and we're excitedly waiting for that to be rolled out. We don't know where that is yet. We are in conversation with OSU, so we'll know more. I think as they're ready to roll it out, of course, they'll contact all of us, and we can make that information available to the media. But right now, I think the important thing is do we have the ability to test? And anybody in Tulsa who need a test, has been exposed, have been sick, have been able to get a test, and to be able to expand that even more is really critical to really let us know where our community stands in terms of the development of herd immunity. We know we're nowhere near there yet. Right now, we're looking at possible 10% infection rates of people who've been exposed, and we know to have herd immunity, we need between 60 to 80% exposure. So we're nowhere near there, but over time, we'll definitely get there.
Okay, Mayor Bynum from Channel 8. You and Mayor Holt of Oklahoma City have worked together during this whole pandemic. As mayors of the 2 largest cities, can you elaborate on how you two have coordinated your response to COVID-19? How often do you communicate? Do you share plans, etc.?
Well, Mayor Holt and I talk throughout every single day and have throughout the duration of this event. I would say he's probably the one of the best sources for advice. He's a great sounding board for me as we both think about how our two metro areas want to react and protect people during this event. I also think it's very valuable that the state's two major metro areas have largely followed the same policies. I think that's one of the things that's really helped Oklahoma flatten the curve, if you will. And so he and I talk throughout every day, and I'm confident that'll continue as we move ahead. He has mayors around the country that he's friends with, that he gets information from. I have other mayors that I'm friends with that I get information from. We share that when we're talking. So it's a real partnership. At least in the time I've been at the city, I don't think Tulsa and Oklahoma City have worked as closely on anything as we have on this pandemic response.
Okay. Mayor Bynum from Channel 8. What will the city do when the state prepares to open? What type of timeline are we looking at? And will we be coordinating with Oklahoma City?
So I had a really good call with Governor Stitt and Mayor Holt earlier this week, and I have a meeting actually later today with my colleagues in cities in the Tulsa metro area to talk about how we can all coordinate these efforts so that there's some uniformity in it as we deploy it. Now, I've said before, and I'll say again, a lot of that is about the how. What different steps are taken? What do they look like? We certainly, nearly everything we've done in putting our social distancing practices in place, Tulsa and Oklahoma City have deployed them at the same time. And our metro areas have really come around and embraced those as well. But I think it's important as we talk about re-engaging the economy that there's an equal playing field for everybody around the state. So I was grateful that the governor reached out and wants all of us to be on the same page on the how of that. But as I've said before, for me, when you talk about the when, and that's equally important, the people who know that best are the folks at the Tulsa Health Department who are on the ground here, who are independent, who are our public health experts in Tulsa. And so I'm going to follow their guidance on the when as to what we do here and when the right time to do it is. I'm very pleased, though, to see most of the talk you hear nationally, whether that's here in Tulsa, around the state. You heard it from the governor. You've heard it from the White House yesterday. A real talk about proceeding in a cautious, phased way. I think that's so important to make sure that the lives that we've saved here in Tulsa in the last 4 to 6 weeks by implementing our social distancing practices early, that we don't squander that by moving too rashly without proceeding with caution. So I'm grateful to hear that there seems to be a consensus at all levels of government on the need to do that.
Okay. Mayor Bynum from Tulsa World. If you decide to extend your executive order past April 30th, how will you balance its mandates for citizens like social distancing with the increasing financial needs of Tulsa's economy, including businesses who've already had to close, lay off, or furlough staff?
Well, that's exactly why I'm having the kinds of conversations I talked about earlier with businesses as to what kinds of adjustments can be made to make them safer for people moving forward. So again, everything I'm hearing, best case scenario is that we don't have a vaccine for this for 12 to 18 months. And that's best case. So we have to realize that there's going to be a new normal for commerce, not just here in Tulsa, but all around the world. And we want businesses to get reopened. I want our small business owners and large business owners to get back to business in Tulsa. But we all have to recognize that a lot of those businesses may not look and operate exactly the same way they did before there was a virus in our community that no one, except for a handful of people that have contracted it so far, are immune to. So that's the purpose of the discussions I'm having, is so that when the health department gives us the go ahead to start rolling things back, that we can allow the deployment of those businesses to move forward and to go back to their operations, but with these new practices in place that keep people safe and help people have confidence that they can go out and shop and live their lives in a much safer way than they would if we just flipped a switch and everybody pretended like there wasn't a virus here that didn't have a very high fatality rate.
Okay, Fox 23 for Mayor. Is next year's budget that you will present to the counselors next week going to be in flux right up until you present it, because so much economic data and other things are changing?
No, I think we pretty much have the budget at this point finalized. It will be presented on Wednesday to the city council. Now, I will say, the council and I have really prided ourselves in the time that I've been the mayor on having a year-long collaborative process where we develop a budget over a really prolonged period of time. And the reality is the economy that we had in Tulsa for the first 3 quarters of the year is a mirror image, just the complete reverse of what you're going to see, at least what we're projecting in the final quarter. And so that's caused us to make substantial changes to the budget, like the furlough days that I announced today, that we were not even contemplating 2 months ago. That's how fast this event has impacted our economy, both this event and the energy markets all around the world, the fluctuations that you're seeing there. So the budget for now is pretty much set. But one thing that, my old colleague David Patrick always used to remind us when I was on the city council and even when I was mayor, that we develop a budget at the beginning of the year using the best information we have for the year ahead. And as we go through the year, we reserve the right to amend it and revise it based on the financial realities that we're seeing as the year goes along. And I wouldn't expect this coming year to be any different. We will continue to monitor both our expenditures and our revenue on a daily basis moving forward through this coming fiscal year.
Okay. Dr. Dart from the Tulsa World. The governor has announced plans for resuming elective surgeries starting April 24th. If doctors locally opt to start doing those again, how will THD help ensure there's still adequate resources at hospitals in the country for those hospitalized due to COVID-19?
The important issue here is that each hospital has the amount of PPE that they need. When they start to increase elective surgeries, they're going to need more PPE. We work very closely with the regional medical response system. PPE is brought in through that network of emergency managers, and we'll continue to do that. We are seeing an increase in the volume of resources and supplies. At the same time, it's not just PPE. It's ensuring that we have the ability to do expanded testing. And it's also, as we said previously, it's important that each hospital understands their surge capacity and their ability to meet surge when we start to see peaks start to rise again once people start to come together. So all those things, it's not just a one variable issue. It's fairly complicated. It's really interconnected. And it's all these moving parts. It's really paying attention to those issues and making sure that we don't miss any of the variables that we set as criteria.
Okay. Fox 23 from Mike Bros. With there being everything from feelings of fear and hopelessness and isolation, how have local suicide prevention programs been holding up over the past few weeks? Has there been an inflow of people with needs?
Well, we're always concerned about, I think, on any given day, any given year, the viewers may or may not be aware that we have about 3 times as many suicides as we do homicides. That's true all over the country. Suicide and the threat of self-harm is always an issue that we're very, very concerned about. And we really need family members, coworkers, friends, neighbors, people who we worship with, to help us identify individuals who are having a particularly difficult time right now and who may even be having thoughts of self-harm. And so to reach out to that person and to tell that person, we're going to get you the help that you need, and I'm going to help you stay with them. And the mental health community is open and it's active, and it's but we do need the help of people in the community and coworkers, friends, families, as I mentioned, to help us identify who those people are. And if you're one of those individuals and you're having those thoughts, please reach out. Again, 211 Mental Health Association. If you're in an extreme crisis, 911. We really want to be there to help us through this time. We know during this period of time that, again, as I mentioned earlier, anxiety, fear, depression, all the ways that this affects us mentally and emotionally, that's going to elevate right now. But we're going to, through helping each other, and again, reaching out to those people who are alone. Don't wait for them to call you. You call them, check on them. And if you sense that they're having a particularly distressed time, check on them regularly and offer to assist them to be able to get the help that they need. And we want to be right now ever vigilant about the well-being of our neighbors and our friends and our family.
Okay, Tulsa World for Commissioner Keith. Can you elaborate on plans for housing for the vulnerable populations and how that will work, plus a possible timeline for how long that will be in effect? She's muted.
Commissioner, your mic is muted. Little city-county collaboration there.
I appreciate that. And again, a shout out to Becky Gligo for helping get this thing to stand up. The Juvenile Center, the county kind of handed the keys over to this group, and today they're actually training folks to be able to go in and help manage that population when they move in next Monday. So we'll have 50 folks moving in that are currently housed at the Salvation Army. And then they'll actually be spending the nights there. But during the day, they'll be bringing some of that population that if you drive through that corridor, there are a lot of people just sitting outside and hanging out together and get meals and some telemedicine. There'll be some wraparound services that are important for that population. So boy, kudos to everybody who's had a hand in making that happen. And anyway, that's kind of the
It appears that Commissioner Keith's camera has frozen. Last question was for her. So at this time, this will conclude our press conference.